A friend of mine recently got a hearing aid, and she's having a bit of a time getting used to it. So I'm coming out here to Audiology Hearing Aid Associates to hear whether this is a common problem with folks getting hearing aids for the first time. And I'm hanging out with Dr. Danny Gnewikow. And is this a hard thing to get used to?
I don't know that it's that difficult, but it is a very common occurrence. I've been dealing with hearing loss for ages, and we've seen this over and over. And the problem with it is sometimes people really need help with their hearing, and because they can't adapt to it immediately, they throw up their hands and quit, and they never go back to it again, and they spend their life with all of the negative implications of hearing loss. When your brain is accustomed to hearing everything in a muted fashion, and then suddenly you start hearing things that you're unaccustomed to hearing, it takes a while for the brain to adapt. It's like when you get up in the night and you turn on the light in your bedroom, it's really uncomfortable because it's such a shock. But if you sit there for a while, your eyes adapt. And in the same sense, it takes a while to adapt to hearing aids. Wearing them consistently is probably the best advice I can give you. People who wear them only occasionally when they have a meeting or they go to a party or go out to eat, and then they complain, well, I just can't get used to them, because that's the only time sometimes people wear them. It's kind of like your glasses. We've all gone through this when we've gotten glasses initially and we've gotten a bifocal or perhaps a trifocal, and we've never worn glasses before, and we say, oh, this is terrible. I can't see perspective. I'm going to fall. And the eye doctor says, put them on, leave them on. And then you go to the dentist, and somebody says, oh, I've got this partial, or I got this little denture in, and I just can't stand it. It is so unnatural. And the dentist says, put it on and leave it on. And then you go to the audiologist with the same issues, and the audiologist says, put it on and leave it on. Now, I've worn hearing aids myself. I can empathize. I've gone through the same sorts of things. So, yes, it does take some time, but the key is wear it regularly. Now, there's one big difference between glasses and dentures and hearing aids. There's not much you can do about those. Your prescription is fixed. But with a hearing aid, we can actually program it to a different level where sounds are less bothersome, even though you don't hear quite as distinctly as maybe we want you to hear. And then after a few weeks or a few months, gradually increase that. So there are things that can be done. So I guess I'd like to summarize by saying a little effort for a few weeks will pay dividends in the long run. So even though it bothers you a little, realize that the technology is out there to deal with most of these issues, but it still comes back that the patient himself or herself are going to have to give it some time and give it some patience and use it on a very regular basis. At this point in time, I can't tell that I wear hearing aids. Even when I make an adjustment to them, it's a little different, maybe for a few days. But once you get over that initial period of acclimation, then changes from then on out are fairly easy.
Wonderful. And to find out more about hearing aids, feel free to call them at 434-528-4245 in the Lynchburg area. In Danville, they can be reached at 434-799-6288. You can also learn more at digitalhearingforyou.com.